up their slide presentation, and then we'll have Rochelle presenting. There we go.
Hi, everyone. I'm Rochelle Pellissier. I'm the Executive Director of Crisis Support Services of Nevada, is our actual name now.
Oh, sorry, Rochelle.
Hey, we had that name for 52 years, so it's understandable that it's hard to remember that we changed our name to reflect what we're doing. So I get it. Sometimes I still refer to us as the Crisis Call Center, so no worries. So go ahead, Julie, and go to the next slide. For those of you who don't know about Crisis Support Services of Nevada, I'm going to give you a brief overview of the things we do across the state, including those things we do with VOCA funding. But we do a lot of different crisis intervention across the state. So just to start out with, Crisis Support Services of Nevada was introduced or established in 1966. It was established as an outreach program of UNR to address Nevada's high rate of suicide. Even back then, we had the unfortunate designation of being #1 per capita in suicides in the nation, and unfortunately held that designation for many years after that. Sorry, I was getting some feedback. Okay. We were established as a 24-hour suicide prevention hotline back then. And this was back at a time, for those of you who were alive back then, where there were no cell phones. And there was only one phone line into each house, usually, and it was a landline back then. And, you know, it is just amazing to me that the pioneers who started this organization way back when there was only one phone line were able to see this as something that could help save Nevadans' lives. So, but in the first few months of operation, the need for our services was so great that the program was expanded to include any kind support for any kind of crisis, because we all know that it takes all different types of traumas to get someone to a point that they're in so much pain mentally that they feel like death is their only option to get out of that pain. You can go one more forward, Julie. And then in 1979, the center expanded its services again to include an advocacy program for victims of sexual assault. And this is one of the main programs that we use VOCA funding for. And some people might ask, what does that have to do with suicide, if that was your initial reason for being established? And the reality is, of the victims of sexual assault, 30% of those have active thoughts of suicide, and 13% of sexual assault victims actually act on those thoughts of suicide. So that's the reason back in 1979 we started that sexual assault advocacy program, and it is increased today to, we deal with all sexual assaults 24/7 across northern Nevada, and send an advocate and deploy the SANE nurse to do the SANE exams for them. Next slide. So the other things that we are doing now, crisis support services operates 24/7, 365. There's never a moment, whether it's holidays or any other time, that we don't have are not fully staffed at answering the phones and answering calls for victims of sexual assaults. Just when people call in, some of the things that we do, we listen, we de-escalate, we create safety plans, we refer the callers and texters out to services, and then if they're at imminent risk of hurting themselves or others, we dispatch emergency services. We do this both across Nevada and across the United States. In the last 2 years, we've also added case managers to our services to do more extensive follow-ups for those people in crisis, to try to get them out to the appropriate services that they need. We have case managers now on duty both for the day shift and swing shift. The only shift we don't have case managers on duty is graveyard. Go ahead. Last year, we helped over 83,000 people. 4,300 of those were contacted us by text message. Of those 83,000, over 20,000 of those were contacts from Nevadans. And this is for all of the services that we provide. 53% were from Clark County, 26% were from Washoe County, 20% were from the rural counties, and 1% are unknown. Our technology can't tell where the phone number is coming from, what county the phone number is coming from. 3,800 callers or texters were victims of current or historic child abuse. We took over 2,200 child protective service reports. Over 800 of the callers were victims of elder abuse, and we took over 300 elder abuse reports. We helped over 700 adults with disabilities who were being victimized. About 2 years ago, it's starting to blur, the state started, the Aging and Disability Services started taking reports for adults with disabilities who were being victimized. So although we've taken these calls, we haven't yet implemented the data collection on how many reports we've taken in the last year for these adults with disabilities. So we're working on that right now. So I don't have a number of reports that we took last year for those. Go ahead. Thanks. So CSSNV is one of 9 national suicide prevention lifeline call centers. What that looks like, you remember I talked about we do national and we do statewide. Across the nation, there's 170 lifeline, independently run lifeline call centers. And each call center has a region that they take care of. Usually it's a county-wide region or different areas in their state. Very rarely is it statewide. So we're one of the few that our region happens to be the entire state of Nevada to take those lifeline calls. So when one of those call centers, their region is being overrun with calls and the call center staff or volunteers that they have on duty can't take all of those calls, then those calls roll over to one of the 9 national call centers, one of which is us. And then we provide that crisis intervention and the help they need to get through that crisis for that person. We not only do this nationally because of the internet, we've also been getting international calls into our facility to help with people who are in crisis. And although obviously we don't have good reference on referrals, thank God for Google. What happens when we get an international caller is we de-escalate and do exactly what we would do for a national caller or someone from Nevada. And then we Google resources in that country as close to them as possible to give them resources in their country. But I find that fascinating, the internet, that we can help people across the world. Of just Lifeline calls, the breakdown in Nevada is 60% of our Lifeline calls come from Clark County, 30% come from Washoe County, and 10% come from the rurals. Go ahead, Julie. We take all of the Child Protective Service reports for rural Nevada, for the rural Nevada counties. We take elder and adult with disabilities abuse reports after hours for the Nevada Aging and Disability Services Division. We also have a statewide substance abuse helpline where people with substance misuse issues can call in. And we do the same thing we do with any, we de-escalate and get them to a point of safety, and then we refer them out to the appropriate services across the state. Go ahead, Julie. We take after hours crisis calls for all of Nevada's rural behavioral health clinics. We also take calls and deploy the immediate mental health care team to adults in the rural counties who are having a mental health crisis or having any issues with their mental health. It doesn't have to be a full-on crisis. The state has clinicians on call for this program Monday through Sunday, so 7 days a week from 9 to 6. So the calls come into our facility. We do what we usually do, that de-escalation, help them get safe, and then we pass those on, if it's between 9 and 6, to a clinician, and can get a caller to a clinician within 15 minutes. I love this program. This is one of my favorite programs out there, that we have the ability to get Nevadans to a clinician that quickly. I'd love to replicate this in our urban areas also. If the calls come in after hours or on a different line, a rural caller comes in on a different line, we'll still get them. If they need help from a mental health clinician, we'll still refer them to the care team. And if they come in after hours, we just let the person know that a clinician will get a hold of them when they get in the office at 9 o'clock in the morning. Okay, Julie, can you go to the next one? We take after hours crisis calls for UNR clinical services, and we also just signed a contract to do this for UNLV's clinical services, taking their crisis calls, de-escalating, and then we send a report to the university clinical or university clinic, I can speak, so that they have the ability to call their student the next morning and give them the help they need. We're the hub of Nevada's health connection through the Open Beds platform. This is a platform that is designed to allow us to give referrals and monitor availability to inpatient and outpatient behavioral health services across Nevada. Currently, there's about 50 of the providers on this platform. It's growing every day. And mostly they started out, the state just started this platform about 1.5 years ago, and it started out with the providers that are funded by the state. But as we grow, the number of providers will grow in this platform also. From February to today's date, we made more than 500 referrals into Open Beds for Nevadans. Okay, Julie, next one. Well, so I wanted to talk about some of the things that we've been noticing post-COVID. What we've noticed is the acuity of our callers coming in, no matter what their trauma is, no matter what they're dealing with, has been much higher than it was before COVID struck. We know that, you know, when I talk about acuity, I mean that they are much closer to that imminent risk of hurting themselves or others. And because of that, we're having to deploy emergency services that much more frequently. Usually we do not deploy emergency services unless we cannot safety plan and help that person to stay safe, and they need immediate help. So what we found is, because of the acuity level of our callers, that our dispatches have increased twofold over the last year. We've done with the state a lot of marketing around COVID, to give them the appropriate place where they can call when they are feeling in crisis. And we all know someone's crisis is their own crisis. You know, what is a crisis for me might not be a crisis for others. So we're helping anyone, whatever their crisis is. And because of the marketing we did, we helped almost 2 times more Nevadans in the last year. The increase in dispatches I was talking about really showed some holes in our system for after we take calls. Currently, both across Nevada and across the nation, and for the last 55 years that we've done this work, when someone is at imminent risk of hurting themselves or others, we deploy law enforcement. And law enforcement determines whether they will go out to that person or not. And as you know, with a physical health issue, when someone calls 911 and are having a physical health issue, we deploy, you know, EMTs or RIMSA. We deploy someone to help them through that physical issue and get them to the hospital. That is not the case with behavioral health issues. It's law enforcement who is deployed, and they determine, it's usually the sergeant on duty, whether they'll go out to them or not. So what that leaves is someone who is at imminent risk of hurting themselves many times and are having the worst mental health crisis of their lives, not getting any services at all, not having anyone come to them and, you know, either take them to a hospital or get them that service that they need. And that's why we have been working diligently with the state to implement a statewide crisis care system, and why it's so vital to implement that system, which includes mobile teams and crisis stabilization facilities that we can get people help when they need it and when they're in that crisis. And 988 is a system that's going to help us, is a program that's going to help us implement that system, both across our state and across the nation. Go ahead, Julie. So what is 988? 988 is the behavioral health equivalent to 911. Again, like I talked about, this isn't just for Nevada. 988 is a national 3-digit number that gets people to behavioral health care when they're in a crisis. 988 will go into effect in July across the nation in July of 2022. The difference between 988 and 911 is 911 has PSAPs in all of the regions across the state. 988 will only come to Lifeline centers. So for the state of Nevada, since we're a statewide Lifeline center, all of those 988 calls will come into our facility. Go ahead. So a lot of the reasons, and I'm not going to go over all of these reasons why 988 is so important is, you know, 30%. We know that the suicide rate has climbed 30% since 1999. It's increased in 49 of the 50 states over the last decade. Believe it or not, Nevada last year was the only state that did not increase our suicide rate. All other states did. And I think that's part of that reason is the work we really are focusing statewide on this. We know that in 2016 and 17 alone, there was a 10% increase in suicides of young people. Go ahead and go to the next slide. You know, and this top bullet I want to talk about, more Americans died from mental health crisis and substance abuse in 2018 alone than died in combat in every war combined since World War II. That's an astoundingly bad statistic, and why it's so important for us to have a crisis care system. Go ahead, Julie. So, how the state is preparing for 988. Currently, we have a diverse group of state leaders from all segments of, you know, the crisis care continuum. We have law enforcement, we have emergency personnel, we have mobile team leaders, we have state leaders, we have local government leaders, and all, you know, about 50 different leaders across the state working to implement and develop the 988 system. And like I talked about a little while, the 988 system is mostly the call center hub, but we can't do our work if there's not mobile teams that we can send out when we can't de-escalate and keep people safe. And there's not a place to go like crisis stabilization centers who don't turn anyone away, and people can just walk in and get the services they need. One of the things that some of the legislation that passed in this last session was SB 390, which was a legislation to allow the provision to charge a fee on phone lines, very similar to 911 funding that will fund 988. The legislation had to pass with 2/3 majority for the legislation to go through because it's fee-based. And I will tell you that it went through with probably 95% of the legislatures on both sides of the aisle approving and supporting this funding for this vital service. And like I said, it's very similar. It's there's a cap on the legislation that the most that can be charged is 35 cents a month on a phone line, and that is there to pay mostly for the call center and make sure that we're able to pick up all of those calls, but also allows us to provide, you know, some funding to mobile teams and the whole system. So go ahead, Julie. So that's a little bit about what we do and the services we provide. If you have any questions for me, I would be happy to answer them.
Michelle, you got a shout out that Salvation Army said that they love the rural mental health clinician connection in 15 minutes. I don't know if anybody else has any comments or questions.
Yeah, I think I said that is one of my absolute favorite programs. That it kind of started with rural clinics, and you know, they devised it and put it out there, and just love that, because like I said, there's nowhere else that you can get someone to a clinician in 15 minutes, you know. So really good stuff, and really replicable across the state. So thank you for that, Erin.
All right, Michelle has to run, so if there's no other question for her, we'll move on to Safe House. But one last call for questions.
Thanks, you guys. I'm sorry I can't stay for both the next two presenters, because I love to hear about other programs across the state, but I do have to run. So thank you all, and hopefully I'll talk to you all soon.
Thank you so much, Michelle. Have a good day. All right. Beth, did you want me to make you presenter so you can share, or did you want me? I don't think I have any slides for you, but.
Yeah, if you want to make me a presenter, I'd be happy to share my little slides I have.
All right. You should get a pop-up.
Yes. Oop, I got to move stuff around. Hold on. It went to the side. There we go. Come on. Okay. Can you see that?
Yes, you can see it.
Okay. Is this like a block thing in front of it? Hold on.
Sorry, I was on mute. No, we just see your PowerPoint.
Okay, so how is that? Does that look good?
Yes.
That looks good. Hi, everyone. I hope you're all having a good day today. I'm presenting from Safe House, which is in Henderson, Nevada. I am the Director of Operations. My name is Beth Flory. That's kind of a title that I do a lot of different things at Safe House. I do a lot of administrative work, human resources, things with bookkeeping, lots of supervisory stuff. So I'm here to tell you a little bit about Safe House here in Henderson. So, sorry, I have my little block is like in front. There we go. Okay, so Safe House has been around since 1994. Our mission is to stop abuse in the family environment by providing safe shelter, support, advocacy, counseling, and education. So we serve victims of domestic violence. It was started by 10 dedicated community members, including Julie and Ken Proctor, and Julie is currently the executive director of Safe House. Now, our actual shelter was opened in 1996. It is at an undisclosed location, but I'll talk a little bit more about that in a second. We have provided shelter, counseling, advocacy, housing assistance, and education to more than 85,000 people since we opened. We provide all of our services free of charge to victims of intimate partner violence. And our goal is to try and provide a trauma-informed and client-centered approach. So understanding that trauma impacts our clients and our employees, and that we put the client at the center of what they want. We try to help them achieve their goals through our client-centered approach. My arrow is being resistant for some reason. There we go. Okay. So again, about our locations, we have a website. It's safehousenv.org. So you can definitely go check that out to learn more about us. We have an administrative outreach office, which is located on American Pacific Drive. That's kind of near where they sell all the cars. So by the Valley Auto Mall. And our phone number at our office is 702-451-4203. And then our other location is an emergency shelter. And that's, you can't Google the address of that shelter for safety reasons for our victims. And the way that individuals access our shelter or any information related to our programs is through our crisis hotline is the best way. It operates 24/7. 365 days a year, and people can just call to talk out their situation, and then our staff members will try to help them problem solve, or even sometimes just listen to whatever the situation is. And that number is 702-564-3227. My arrow does not like me for some reason. There we go. So we have 4 core programs. You kind of heard this in our mission statement. We have the Emergency Services Program, the Advocacy Program, the Counseling Program, and our Outreach and Education Program. So for our emergency services, that includes our 24/7 crisis hotline. It also includes our 24/7 emergency shelter. We shelter victims and their children, regardless of gender. I know a lot of people kind of associate women and children with domestic violence, but it can impact all individuals. In our shelter, we strive to provide meals, clothing, all essential items, again, all free of charge. A lot of times victims come into our shelter with the clothes on their back and that is it. So we try to help them get all of those items back, or replaced, I mean. We also have a case manager that works in our shelter. So that case manager meets with the clients, helps them develop their own plan on what they want to do, and helps them achieve that plan. We provide lots of referrals and stuff like that. And then our residential advocates. So our residential advocates work in the shelter. It's shift work, so they're there 24/7 again, and they help those who are living in the shelter with whatever needs that they have, from really simple things to, hey, I need some new hygiene products, to, maybe they had a really tough appointment earlier in the day and they're in crisis, and these individuals help talk through that crisis with those people. These staff also are the individuals who answer our crisis hotline. So they kind of have a double duty there, where they're answering the hotline and they're assisting those individuals who are actually residing in the shelter. Now, our advocacy program, our advocates help both our individuals who are residing in the shelter, as well as individuals who may be residing in the community. So the advocates are mostly located in our administrative office, but they do go to the shelter to help clients. They'll also meet in public places in the community to help clients if they have, they can't transport into Henderson or something like that. Then our advocates will try to meet somebody in a location in the community that works. They provide referrals to victims. They may assist with temporary protective orders, custody, CPS, divorce, lease termination, victims of crime, the CAP program, and a lot of other legal issues. They are, however, not lawyers. So when it does escalate to needing legal advice, they will help the clients connect with lawyers. So we work a lot with like legal aid and those kind of programs. They will attend a court with clients as more of an emotional support type situation, or help kind of explain what typically happens in the courtroom to help prepare the client. They provide a lot of emotional support and crisis intervention to victims. They help a lot with immigration questions. And we do have bilingual victim advocates who speak Spanish, and one in particular who kind of specializes more with the immigration questions. And then we also have 2 advocates who are located, one is in the Henderson Police Department substation, and then we have another advocate who's located in the North Las Vegas City Attorney's Office. So we are kind of around the city with our advocates and really can help anybody in the area that is needed and beyond. Especially with the amazing new technology available virtually, we definitely are able to connect with a lot of different people. Lots of advantage there with rural communities too in our area, which is awesome. Now, we also have our counseling department. We have licensed mental health therapists. We have 3 of them currently. Our counseling director, the director of the program, is also a children's therapist. That's her specialty. We also have bilingual therapist in Spanish. our counselors serve both victims who are residing in our shelter as well as those who are residing in the community. We often find a lot of times when individuals come into their shelter, it's kind of early to start counseling. So a lot of them actually start the counseling process as they're leaving our shelter program. And they're in the community, they are feeling stable, and they want to come into counseling to get assistance. And then we also, our counselors have specialized education in domestic violence as well as various ways to assist individuals with trauma. So lots of specialized training with our counselors. Outreach and education, our other program. We actually have one employee that works in this program, and then as well as volunteers that support her. So outreach and education for us is really just how can we provide outreach and education to anybody. So that is providing support groups for victims. She does both support group at our shelter as well as support groups virtually in the community currently. Outreach personal table at community events. That could be health fairs. We've also done it for businesses before who do like health fairs for their employees. We do presentations to community groups and businesses. We do virtual outreach through social media platforms. We also have print materials that we can provide. And then we also have a volunteer program. So volunteers for us can pretty much volunteer in any capacity within Safe House, except for counseling, of course, because that requires special certifications. But our volunteers help within the shelter, they help with fundraising, they help with outreach, pretty much anything you can imagine. And currently, now we do have training for our volunteer program. We typically hold it twice a year. But since the pandemic, we have utilized the Nevada Coalition's training program that is virtual. It's a really great program. I'm also personally a board member for the Nevada Coalition. So I always encourage people to check out the coalition, become individual members of the coalition. It's a really great state coalition that advocates for victims of domestic violence and sexual assault, and it's a great program. And that training program is really excellent. It's like 24 hours, I think now, because they've added some modules since becoming a dual coalition for sexual assault. So volunteer program is awesome. We have quite a few volunteers that assist us, and just can't stress enough how much we appreciate our volunteer program. So that's basically all I have for now. Here's, my name and my title and my phone number and my email. If anyone ever wants to ask me any kind of questions or reach out, I'm happy to talk to anybody. I love talking to people about Safe House and about what we do and about helping victims of intimate partner violence. So definitely can reach out to me anytime that you want to reach out. So that's all I have. So if anyone has any questions, I'd be happy to answer them.
Thank you so much, Beth. Anybody who has questions, again, feel free to unmute yourself or type them in the chat. Okay, I'm not hearing any. You can continue to post any if you think of them as time goes by till the end of the meeting. Next, we have Community Counseling Center, and I hope I'm going to pronounce your name right, Arinel. Is that correct?
Arinel, yes.
Okay. Would you like me to make you the presenter, or would you like me to pull up your PowerPoint slides?
I can make myself the presenter and see if it works okay. If that's
Okay.
good. Thank you. All right. Okay. Okay, is my screen sharing with the PowerPoint?
Yes, it is.
Okay, fantastic. My name is Erin Ellen, the Deputy Director at Community Counseling Center, and I've been here for a little over 16 years now, so I'm a little bit in love with the place. And I'm excited to tell all of you about what we do. So Community Counseling Center has been in the community for 31 years now. We were founded in 1990, and we provide both substance abuse and mental health treatment, as well as HIV supportive services. And our mission is to promote the healthy functioning of individuals, families, and communities through affordable, sensitive, and professional behavioral health services in a safe environment. For those of you who aren't familiar, we are located on East Sahara, just between Maryland Parkway and Paradise. So we're pretty accessible for bus lines and just generally fairly easy to find. All of our therapists at CCC are certified by the Nevada Board for Marriage and Family Therapists, the Nevada Board for Alcohol, Drug, and Gambling Counselors, or the Nevada Board of Social Workers. In some cases, they have multiple certifications. And then our additional staff includes case managers. We have 2 HIV supportive services specialists, peer navigators who work in our HIV-related services, HIV testing specialists, because we do have a lab on site where we offer free rapid HIV testing. We also have client care advocates who serve kind of as a liaison between just the clients and any other service that they need, just so that if there's anything that they feel they need more of, if they're confused about the process, just someone who can kind of handhold as they go throughout the process so that they don't feel lost at all. Because we know for a lot of people, coming in for therapy is really scary. It's, you know, for some people, they're coming in on the worst day of their lives. So we want to make sure that there's somebody who's always there along the way that will help them get to where they need to go and make it a little bit less scary if necessary. And then we also have a compromise. Oh, go ahead.
Sorry to interrupt. I don't think your slides are advancing.
Uh-oh. Okay, let me see.
I think you might have to click on the slides.
I mean, they're advancing on my end, so.
Oh, bummer.
Yeah, let me see. Let me see if I just share my whole screen, if that makes a difference.
Okay.
Let me see. And if not, then maybe Julie, I'll have you do it. Let me see if this will work. Okay, can you see that's the different screen now?
Yeah, this is who we are.
Okay, we'll see if it goes with the next one then. So in addition to the staff that I had previously mentioned, we also serve as a site for bachelor's and master's level students from a number of universities around the country. Primarily, I would say they come from UNLV. But we have had numerous additional colleges and universities reach out to us in recent years. So we're always happy to entertain student interns, and in many cases, we do end up hiring them after the fact. Okay, did this advance?
Yes, it did. Thank you.
Okay, perfect. Okay, as far as who we serve at Community Counseling Center, our primary services are directed at adults, but we do have an adolescent program for individuals who are age 12 to 17. We do see children on occasion, but typically it's related to a family counseling situation where we're looking to expand our services for children in the coming year or so. It had gotten a little bit delayed because of everything that we had to modify with COVID. But we are definitely moving toward a much more expansive breadth of individuals that we serve. We have specific services for couples, families, as I mentioned. We have a program specifically for LGBTQ identified individuals. As I mentioned before, people living with or affected by HIV, and then also the Spanish-speaking community. As far as services we offer, we provide comprehensive evaluations as well as mental health and substance counseling, both individual and group counseling. We have a co-occurring disorders treatment program for individuals who are more severe in terms of their diagnoses, who typically have both a mental health and a substance use related diagnosis. and these people are typically also receiving psychiatric care at the same time. As I mentioned, an adolescent services program, case management, HIV supportive services, LGBTQ support groups, and we actually have a program I'll describe in just a minute related to LGBTQ services, and then again, free HIV testing. Just of note at this point, we are not doing our HIV services, our testing services at this time just because of some modifications we had to make during the pandemic, but we are hoping to get those back up and running in the next couple of months. Just to tell you a little bit about our different programs, our substance abuse and co-occurring disorders program offers treatment that provides a continuum of care for early intervention and prevention as well. These are all outpatient services, and we also offer an intensive outpatient program for individuals who might need a little bit more hands-on care. So those individuals may attend up to 5 times per week and as few as 3 times per week, but they're definitely coming much more often, as well as aftercare. Like I mentioned previously, our co-occurring disorders treatment is available for those who have both substance abuse related issues and also suffer from mental health issues. And then when necessary, we can conduct your analysis on site. Typically, these are for clients who are coming from parole and probation, and they need to demonstrate that they're maintaining sobriety during this period of time. Our mental health services, all of our clinicians are trained to recognize, treat, and appropriately refer people who are experiencing impairments in their mental health. Our counselors in particular are very proficient in treating a variety of issues, specifically trauma related. We have taken great pride in the fact that most of our clinicians, or the majority of our clinicians, are very highly trained in providing trauma related services. So many of them are trained in modalities like EMDR or DBT, just so that when clients are coming in, they can feel confident that we have evidence-based services available to them to help them get through whatever they're experiencing. We offer some mental health groups as well. So we have a group called Control that is for individuals who are struggling with stress impulse or anger management. And then we also have groups specific for people who are dealing with trauma. We have offered relationship trauma groups in the past, and also groups for victims of crime, which is funded through VOCA. Our community health program is our program that is focused around assisting people who live with HIV and AIDS in developing coping skills that emphasize social, psychological, and physical well-being. So this program is really largely focused around wellness these days. Obviously, when CCC first began in the early 90s, we were looking at a much different idea when we were talking about HIV-related services. So it's been a very welcome transition into services that are really focused on living a long and healthy life. So these services are provided in a safe and sensitive manner for all of our clients. And we offer a program within our community health called the Living Room. And so this is a more unique and innovative program that we offer that provides supportive and confidential psychosocial case management and therapeutic services to people who are living with or affected by HIV. The groups listed there are the groups that we offer in the program. But this program really came about because we had clients coming to us saying, well, I have to go to this location and to this location and to this location to get everything that I need. And it occurred to us that why can't we just provide one place where everyone can come and get their case management and get their counseling and get their social and psychosocial support. So the Living Room was born out of this need for convenience for clients who were often, many of them don't have vehicles, so they would have to take numerous buses. And in the summer, that's especially difficult for clients when we're dealing with high temperatures and, they're already immunocompromised and dealing with a number of different issues. Our adolescent services are available for clients aged 12 to 17, as well as their parents. So this includes mental health and substance use counseling. We also offer a group for parenting skills and support, and then psychosocial support for the adolescents, which typically will focus on things like bullying and peer pressure, and then also things like, prevention, substance use prevention, and things like that. So we offer both individual and group counseling to assist in the specific areas listed here. We also work very closely with the Department of Juvenile Justice Services to provide services in the detention center in Las Vegas, as well as Spring Mountain Youth Camp that is located on Mount Charleston. Affirmations is our newest program. This is our LGBTQ affirmative counseling program, and it is a partnership between Community Counseling Center and the LGBTQ Center of Southern Nevada. So we actually offer this program at both locations, both at CCC on East Sahara and then at the center. We have an office as well. Excuse me. So these services are all offered in an LGBTQ affirmative manner. And what this means specifically is that all services are offered from a perspective that promotes support, compassion, and respect for each participant's unique sexual and gender perspectives, orientations, identities, and expressions. And ultimately what this means is there are often times when people may come in for therapy and we can't guarantee how other people in the group are going to view them or think of them. And it's not, it's not the place to discuss specifically, to lecture anyone on how you need to view somebody else. So this program is just guaranteeing that whenever you come in for a service, you will be respected exactly for who you are, that you can be who you are. You don't have to worry about any outside influences, and that, we'll work with you to establish your goals and help you with whatever it is that you need. So these are available for LGBTQ plus individuals and couples, as well as family members, loved ones, and allies. So you don't have to identify within the LGBTQ community to receive services through affirmations. You just need to specify with us that you would like to be seen through that program. But the goal for this program ultimately, like I said, is just we're wanting to offer a safe space to everyone, and just the notion that no matter who you are, you matter, and we want to recognize that. Our case management services are focused around client care advocacy, and so we offer targeted case management. We also work with the Ryan White program to offer medical case management for people living with HIV, so we can do enrollment here as well. In the past, we're not currently funded by HOPWA, but we do assist with housing when necessary. So we work closely with local organizations like S.A.F.E and Golden Rainbow to provide this. And then we also provide case management through our Victims of Crime funding. We also offer a resource room on site where we have interview clothing and shoes available for people who are coming in for case management and are in the process for job interviewing, and they might not have appropriate clothing or they're homeless. So we have those available. We also have blankets and coats available in the winter time, and we will provide toiletry kits so that if people need shampoo or mouthwash or deodorant or things like that, we have them available. Like I mentioned too, we offer free HIV testing on site. So we also provide harm reduction and safe sex education as necessary. Free safe sex kits are available. And upon the first test and then any subsequent test every 6 months, we will offer gift cards to those who are testing, just to encourage that they keep up with their regular tests. The testing is performed in a certified on-site lab, and results are available in 15 minutes or less. So like I mentioned as well, we're hoping to get this back up and running in the next couple of months, but we're just kind of waiting to see how everything goes. We offer a student intern program available to bachelor's and master's level students. So this includes individuals who are working in social work, human services, clinical mental health counseling, and marriage and family therapy. And they can complete their practicum or their internship hours here. So we provide them with supervision, we provide them with a caseload, and they can work pretty much anywhere throughout the agency that they're interested, just to really help them get a sense of what an actual career in the field would be like, and to gain the clinical knowledge that helps put them on the right track to obtaining their degree and ultimately their licensure. So, and I just wanted to give everyone a little bit of an overview as to what our client process looks like. So if you were to refer a client to Community Counseling Center, what would their experience look like? So anytime a client comes into the agency, they must first complete a comprehensive evaluation. Right now they are by appointment only, and this is primarily due to COVID, but once everything is a little bit safer, we probably will go back to having walk-in hours as well. so that clients don't necessarily have to have an appointment if they're coming in. The comprehensive evaluation typically takes about 2 hours, and it's really just because it's so in-depth. It's a confidential one-on-one session with a therapist that ultimately determines what the client's diagnosis is, what services they need, and how to best suit their needs through creating a treatment plan. And then whenever the clients come, they just need to bring an ID, so their driver's license, a photo ID of some sort, passport or military ID, their insurance card or Medicaid card. And if they don't have either one of those, we will work with them to figure out if they qualify for example, for VOCA funding or for under any of our other funding sources. And also an open mind, because as I said, coming in for counseling is often incredibly difficult and scary. And a lot of times there are preconceived notions about what getting therapy looks like or sounds like or how it might appear to others. So we just really hope that when clients come in, they're willing to give it a chance and see what kind of a difference it can make for them. On the first appointment, the client will complete their paperwork with the front desk and have their insurance verified if necessary. And then they'll meet with our client care advocate, who will review the paperwork, make sure everything is complete and their referral information. They'll go over what HIPAA rights and our client rights, what that means as far as their own privacy, and that they can feel assured that anything that they share while they're at CCC will not be made public to anyone. We also explain the assessment to them, what that will entail, what the treatment will look like, and why their case management is offered to them. We'll ask if they want HIV testing, and then we'll link them to a case manager. And in some cases, not all clients will need case managers, so that determination is made at the time. With the case manager, a needs assessment will be completed. So if case management is needed, if the client needs to be enrolled in insurance, that will happen. A treatment plan for the case management is created, and then a scheduled follow-up is made. And then the case manager will do a handoff to the counselor so that they move on to their therapy. The client will complete the comprehensive evaluation with the counselor, and then if treatment is necessary, they'll be given their treatment recommendations. So, for example, you'll attend once a week for 12 weeks and attend a recovery group. And then after that, the client will meet again with the care advocate just to schedule the next appointment, make sure that any questions that they have are answered, and that they're feeling good about all the steps moving forward. As far as payment for services, we do accept Medicaid fee-for-service and all the Medicaid HMOs in Nevada. Qualified clients who don't have Medicaid or insurance are charged nominal fees based on a sliding fee scale, but we always do look at every grant opportunity we have available that could cover services for qualified individuals. So again, this is where VOCA may come into play, Ryan White, SAPTA, etc. But we do take very much pride in the fact that CCC will never deny services to an individual in need based on an inability to pay. We will do everything we can to make sure that someone in crisis gets the care that they need. Lastly, during COVID, like I'd mentioned before, we've had to make some modifications, and this has actually worked really well for us in the sense of being able to offer telehealth now. So we do offer telehealth services for both counseling and case management, maintaining our normal business hours of 8 a.m. to 8 p.m. Monday through Friday. The telehealth services are all conducted via via phone or video through Zoom. And our Zoom platform is completely confidential. Recording is not possible. So we do everything we can to keep this HIPAA compliant. Rapid testing services are temporarily on hold, and some on-site services may be available to vaccinated clients now, but we do require proof of vaccination. And this is just to keep everyone safe. We do require that face masks be worn while on site for employees and for staff. And this is, again, we want to keep everyone as safe as possible. But we understand too that some people really benefit much more from in-person services. And we also want people who are not quite comfortable coming in person to know that options are always available to them. And so I think that is everything I have. Thank you so much for listening, and I'm happy to answer any questions.
Thank you so much for the presentation. I know we're a minute over. If people need to leave, we understand, but hopefully we can stay on for a few questions. We did get one. Do you have a waiting list right now?
We do not. We actually are able to take clients right now. And I'm sorry, I realized
And
my
then-
oh, I'm sorry.
Oh, that's okay, go ahead.
I just realized my email was not in the presentation, so I'm going to put it in the chat just in case anyone needs to reach out.
Great, thank you. Safe House also wanted to let us know that 2 of their counselors are also trained in EMDR. And then we also got a comment that the series is valuable and that they're enjoying getting this information on a day-to-day basis, and they don't usually get it on a day-to-day basis until they need the services, so it's great to get it in advance. Does anybody else have any questions or comments before we end the meeting? Well, I want to thank all our presenters today and everybody for attending. I'm really glad that we get this valuable information and can have this time to meet. We do have 2 people scheduled or 2 agencies scheduled for next month. So if you're interested in presenting, we do have 1 more opening. And with that, I'll give you guys the rest of your afternoon and hope you have a great rest of your week. Thank you, everybody.
Thank you so much.
Thank you.